So one of the key functions of the child protection area of responsibility in an emergency setting is to help come up with a strategy on where are we going to work, who do we need to help, what kind of help do they need, how many people are they, and therefore how much is it going to cost. And to do that, we need to be able to classify locations of displacement according to the severity of need for response, because we could end up in a situation where, for example, like in Ethiopia, we have 3,000 displacement locations. We don't have the capacity to respond everywhere. So we do need to classify them in order to prioritize where we are going to be sending our response. Now, issues with emergency response in terms of data is that we often have to make strategic decisions with incomplete and sometimes contradictory data, but we need to move. And so we need to make do with what we've got and what we can get in a lot of circumstances. And it becomes especially difficult with child protection data because child protection incidents are often taboo subjects. So we're thinking about, situations of abuse, situations of violence. And when we collect data, we cannot go door to door asking people if they are abusing their children for obvious reasons, right? That's very unethical. And even if we did collect data like that, it would be underreported. So it would make it look like the problem is way less prevalent than it is in reality. And so without having direct data on what is happening to children, the challenge then becomes, how do we prioritize where to go when we don't know what's happening to those children?